I don't know if there will be a vote on health care or not.
Not until next year, they say.
Yeah, that's what I'm thinking about. I don't think so either. I don't think that they tried to force something today.
When's that CR run out?
Continue the end of January? Last day of January?
So they basically got themselves another month to figure it out.
But here's the thing. Take away the CR, because once these rates are set, they're set. So if they come up with something in February, they're not fixing it then. These rates are set for the year. I mean, if you could have heard Bell just trying to talk to a human being today to get his damn card number, imagine if they had to go back and try to fix the rates. This just isn't going to happen. This is Chip Roy, old Chip Roy today, talking about healthcare and kind of going after both parties.
And now we're sitting here and we're listening to nonsense about healthcare, where my colleagues on the other side of the aisle sit here saying, well, you guys aren't doing anything about the massive expensive cost of healthcare. Why do you think it's expensive? Because you literally cut a deal with insurance companies to run healthcare. You think that's going to run wild? Yeah. That's why they have 2,000% profit increases, and the American people can't afford to go to the doctor of their choice while we enrich insurance companies. And yet Republicans will complain about it, and then they'll offer milquetoast garbage like we're offering this week, and then go home at Christmas and say, look at what we're doing. We're campaigning on reducing health care. Well, congratulations. At some point, people will look at this body and say, maybe we should get rid of all 435 members of the House and all 100 members of the Senate and start over, because Congress is literally failing the American people. I yield back.
He called them milquetoast. 15 years, by the way, Republicans. Everybody's been waiting on your plan. 15 years. I don't know if somebody forgot it somewhere, but your plan isn't going to, whatever plan you're trying to pretend that you're going to roll out isn't fixing anything. It isn't. Your best bet is to do another year. It sucks. Yeah, we get it. Obamacare sucks. We've all been there. Blah, 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 blah. You can say it over and over again. But what are you going to do? Because it's going to land at your feet, whether you like it or not. And Mike Johnson is not reading the room. Why? He's in a super safe district. They're not getting rid of Mike Johnson.
We knew that we were coming to the end of the year when it would expire. And remember, the Democrats created this COVID-era subsidy.
Nobody cares about who created what at this point in time. You're in charge. Fix the problem. You're blaming the old chef, who's no longer the chef, on the menu that you didn't create. Well, guess what? You're creating your own menu. This is one of those damn things.
They are the ones that put the expiration date on it, and now they're turning to Republicans as if we should save that in some way. We couldn't find consensus on it with the body in order to pass it. Here's the reason. Everybody needs to understand there's a false narrative out there about these subsidies. It's subsidizing insurance companies, and when you do that, you're masking the cost, the rising cost of healthcare, and you're making the premiums rise even further. But here's the false narrative. The Democrats are pretending as though this affects everybody in the country. It affects 7% of Americans, this extended subsidy. And of those, even if it was extended without any reforms at all, it would only reduce that small group of Americans' premiums by 5.7%.
You're not reading the room. You're just not, dude. Like Ken's going, he's not. He's just not listening.
Yeah, we send people to Congress to work together.
Yes.
To get things done. They're not getting anything done.
No, they're not.
I mean, we do have the one big, beautiful bill through, and we'll see what that does for us in this next year. But right now, whether you like it or not, 7% of Americans are going to suffer no matter who pushed this through. They're going to suffer.
They are.
And it's going to end up costing us all.
Yes, because that's the other thing that, Mike doesn't take into account is when the pool shrinks of healthy people, what happens? Well, they dilute it. So they put all the other risk is going to be shifted to the other plans and the other people. So we're all going to see an uptick. Look, there's no perfect thing. But you continually saying, well, this is not our fault, it's their fault. Nobody wants to hear that. How are you going to fix it? You're in charge. Great, it's their fault. We could talk about it all day. Right? You could name the bill, Obamacare sucks, it broke the healthcare system. Call it whatever you want. But what is your plan? And you didn't have a plan. And Chip Roy called everybody out on that. And the one plan that you guys have had, or the two plans, are milk toast. We're going to give you $1,000 or $1,500. Your premiums are going to go up by $4,000 or $5,000. You can't spend any of the money on your HSA accounts that you're getting on any of this stuff. Really. So have fun. It's broken. We get it. But you better figure something out. And they don't want to. I don't know. And they can say, well, you can blame it. Here's the thing. You can blame it on the Democrats all day. But they're going to look at you and say, but you're in charge. Now, this was the goal. You guys got in charge. You were going to fix it. And you haven't. And millions of Americans who are going to see their rates go up, even people who aren't on the exchange. Now that pool, that stuff's going to be spread out. And what are they going to do? The Democrats are going to roll out all kinds of stories about so-and-so, father of two, has a small business, can't afford health care. He's rolling the dice. Such and such, having to work 9 jobs to pay for their premiums and their health care because they can't afford not to, and there was no subsidies, and the $1,000 they got or $1,500 they got doesn't really go anywhere to cover a lot of these things. It's frustrating. And go look at Obamacare right now. Strongest, highest numbers it's been in a long time. Why is that? Because people worry when you take something away, unless you're going to replace it with something better, they think, oh my God, it's going to land on our head. They're trying to do the Indiana Jones. They're trying to, try to replace that thing, take the little sand thing off and put the other one on. They're not even doing that. They're just taking it off and seeing if the ball rolls.